African Mental Health Foundation is a non-governmental organization that was established in the year 2000 in Nairobi and has since offered community mental health services to both urban and rural populations through collaborations with relevant government ministries, the Nairobi City Council, local and international universities, among other development partners.
We partner with the government, with the Minister of Health, with the Minister of Public Health, with the politicians, national and grassroots level, with faith healers, with traditional healers, with all mental health workers, with all medical health workers, with the opinion leaders, with the community members. It is a collective effort involving everybody.
Mental illness is defined as any illness that affects the normal functioning of the mind of a human being. It can also be described as the state when one's mind is not working optimally or deviates from the normal. In extreme cases, the illness is referred to as a mental disorder, and research has shown that at least 25% of all people seeking help at primary care level are suffering primarily from mental illness, and another 25% present both the mental and physical condition, making a total of 50%. Only that they do not know.
Mental illness is any illness that affects the normal functioning of the brain, in very simple terms, so that the behavior or the thinking of the person or his attitudes to other people and towards himself and his feelings are outside the normal range of normal.
Sometimes there may be imbalances in the body system for certain chemicals. If some chemicals are lower than others, then that can cause a mental illness. If they are higher than others, that can cause a mental illness. In other words, within the body system, chemicals are supposed to be balanced in a certain way. There is also the hereditary factor. Some mental illnesses tend to run in families, and there's really nothing one can do about that. They just run in families, but they can be treated. The other factor is environmental. If someone goes through a lot of stressful events, and I'm not saying one can live a life without stress, but if the person is not able to cope with that stressful event, that can be a contributing factor to the development of a mental illness.
There are only 77 qualified psychiatrists in Kenya against a population of about 40 million people. This means that there is only one psychiatrist for every 500,000 people. Worse still, all these 77 psychiatrists are based in urban areas and in private practice, which makes it very expensive for the ordinary person to access their services. In fact, there's not a single psychiatrist working at the community level, a situation that prompted one professor, David Ndetei, to explore means and ways of making community mental health services accessible and affordable to all.
The 77 psychiatrists, most of them are in urban areas, most of them in Nairobi, quite a big chunk of them doing private practice, and only for those people who can afford their services. In fact, in Kenya, we don't have a psychiatrist working at the level of the community full-time. We don't have that kind of luxury.
The African Mental Health Foundation, whose unwavering mission is to pursue excellence by conducting high-quality research on mental health and behavior, has for the last 6 years taken the lead in imparting mental health skills to personnel working at community and health facility levels.
We are going to be training every cadre of staff. We shall train the community health workers again. We shall do more training for you faith healers. And we shall do more training for traditional healers. We shall also do more trainings for the health staff at the facility.
Wakati hii NGO imeingia na ikatutrain kama community worker na ikatrain faith healer na ikatrain traditional healer, tumesaidiana na tukasaidia community, na wengi wakajifahamu kwamba wao ni wagonjwa, lakini walikuwa nafikiri wagonjwa wa akili ni wale wanafua nguo na wanatembea sokoni na kulokota makaratasi.
Currently, the African Mental Health Foundation, in collaboration with the Ministry of Health, runs 2 mental health clinics. One is situated in Kibwezi, a rural area over 250 kilometers away from the capital, Nairobi. The NGO identified Ngwata Health Center, which has overwhelmingly transformed the community. In a span of 1.5 years, the foundation has conducted trainings to community health workers, faith and traditional healers, and health staff on how to identify and provide basic interventions to mentally ill persons and refer to Ngwata Health Center. The patients who initially used to visit traditional healers are now coming to seek medical attention from the facility.
Initially, there used not to be anything to do with mental illnesses. We never used to identify. We only used to prescribe the psychosis. But since African Mental Health Foundation came, we have seen the numbers increasing significantly. Because of the training which we have underwent, we are able to get on diagnose those patients who are suffering from the same.
Kamtembelea kama community health workers, nikakuja nikapata shida yake. After tushamuelezea masomo ya mental health, tukapata alikuwa na shida ya depression, na vile ilianzia alisema kuwa alikuwa na msichana wake ambaye aliaga, na kuanzia hapo ndio alishtuka na shida ikaanza hapo. Nikakuwa kuna chembe ya moyo, anxiety, mara hali vizuri. Ndio tulichukua hatua ya kumtuma hospitali, na kaenda akapata matibabu, na baada ya kumtembelea tena akasema yuendelea vizuri.
In the capital, Nairobi, African Mental Health Foundation is also collaborating with the Kangemi Health Center, whose population catchment is over 95,000 people. Consequently, the facility runs mental health clinics twice a week and has gone a long way in capacity building their health staff to provide mental health services.
Kangemi Health Center is a facility that offers primary health care to our community, whereby we are serving around 95,481. That is our catchment population. We have a mental clinic, a mental health clinic twice in a week, that is on Monday and Wednesday. That is through the aid of the Mental Health Foundation, and it has been doing well, and we've seen many clients benefiting from this.
African Mental Health Foundation has been able to sponsor us in areas such as capacity building, in training our staff so that they can enhance their skills in diagnosing and treatment of mental illnesses. They have also provided mentorship opportunities to most of us by availing consultation services that we can see them and consult if in case we have any problem. They have also participated in logistics in terms of provision of certain learning materials and even stationaries.
In a bid to live to its vision of commitment and promotion of mental and neurological health and behavior, the foundation has identified and appointed Tawakal Medical Clinic in Eastleigh, an estate that is mostly inhabited by Somali refugees. It is here that the 2 doctors, Abdikadir and Maimuna, burn the midnight oil to give hope to men, women and children who survived the long Somali civil war.
أنا حسوست مرة وأنا هذا أنا حسوس بالربي.
In this facility, one patient narrates how she lost all her 5 family members in an explosion, as another can't cope with the disappearance of her 3 brothers to the same war. As tears freely flowed down her cheeks, the doctors told us that there are many more patients who are suffering from post-traumatic stress disorders and are in dire need of treatment.
She's a patient with post-traumatic stress disorder, and also she developed complications like hypertension and diabetes. She is alone. She remained only herself from a family of 6. The 5 brothers died. The mother died also. She came here as wounded. She has been referred to Nairobi, and she died here in Nairobi. Now she's alone. We treated her before even she was not able to communicate. Now, as you can see, she's much better. but whenever she reminds her about in her past, she has these crying spells. She's not the only one. The PTSD prevalence in Italy is so high that it's unbelievable sometimes. And now we have also a branch, Africa Mental Health Somalia. There are 3 autonomous regions where also Africa Mental Health is helping. It is the only, I can tell you, organization which is helping really helping the people suffering here through training. For example, me and Dr. Maimuna, we have been trained in the University of Nairobi and by Professor Ndete, who is the head of Africa Mental Health.
In the same breath, African Mental Health Foundation played a leading role in debriefing and counseling families of victims of the 1998 Nairobi bomb blast cope with the tragedy. Likewise, the year 2008 saw the AMHF staff members spend days on end providing mental health interventions to children and adolescents who experienced traumatic events during the chaotic 2007 post-election violence in Kibera. African Mental Health Foundation has also made other achievements in publishing many books, contributing in journals, and releasing reports on hospital-based studies, community-based studies, school-based, post-disaster studies, drug-related studies, surveys on disabilities, among others.
We've written several books and we're in the process of writing several books. And it's a place where I think a lot of mental health work is being done, particularly in the area of research.
I started coming here as a postdoctoral fellow in 2008 and have been doing research projects with Professor David Ndete and the fellows at the Africa Mental Health Foundation for the past 3 years. We're running a research project here at the Kangemi Health Center where we're testing the prevalence of mental health problems as well as alcohol use disorders amongst people who come in for voluntary counseling and testing for HIV.
In spite of these achievements, African Mental Health Foundation has faced a myriad of challenges in the course of executing its mandate. Being in Africa, most patients suffering from conditions like schizophrenia, epilepsy, bipolar disorder, depression, anxiety, and sometimes just mild stress would prefer to visit traditional healers, witch doctors as opposed to conventional clinicians for treatable conditions. This traditional belief has resulted in many deaths, especially in villages where witchcraft thrives. However, these traditional and faith healers have started referring some of their patients to the health facilities.
Tunaendanga na wakatupia ndawa na tukarudi na nilionyeshwa nimeiva na hizo ndawa mimi naamini nikikunywa kama simangamangi itapoa, lakini kimangamanga siwezi kupoa.
Nilikuwa nimeona hiyo shida yake, alikuwa anaaguka hiyo ya ugonjwa, alikuwa na ugonjwa ya akili pia, na pia akiaguka si ile epilepsy tunaweza sema hii ni kifafa, anaaguka tu hatoi pofu. Nikaona hii shida yake si ya kumalizia hapa, ndio nikampatia nikamtuma Kagemi.
Kazi yangu ni kuombea wagonjwa na pia wengine wanataka tu tuendelee na maombi, lakini kuna wengine na washauri maombi na dawa pia. Sasa huwa na referral wanakuja hapa Kangemi Health Center, wanatibiwa pate madawa.
The other key challenge is alcohol and substance abuse that has clocked fever pitch. Right from men across women to children, alcoholism has become a serious problem in the Kenyan society.
Hiyo ningeweza kwanza ningeshukuru serikali ya Kenya ile nafasi ambayo alipeana watu wawe na kunywa pombe baada ya kazi kama kuanzia saa 11 na mambo kama hayo. Ile pombe ambayo si halali, have enough personnel wale wanahudumia hiyo kazi, na mahali tunasikia iko hiyo pombe inauzwa, watu wanashikwa, they are being apprehended and then they are being taken to court.
In conjunction with the alcohol use disorders, we find high prevalence of other mental problems, depression, anxiety, thoughts of suicide, even suicide attempts, in which we give counseling. The same clinical psychologists see people not just for their alcohol use problems, but they counsel them and they provide psychological treatment for these individuals.
The African Mental Health Foundation, which believes that in the near future it will have presence across the country, is appealing to all partners of goodwill who have an interest in mental health to come on board and work together to finally bring hope for mental health to all in Africa.
The next 10 years or so, every Kenyan should have access to available, appropriate, affordable mental health services, and this is the philosophy of African Mental Health Foundation.